Good evening and a warm welcome to everyone to today's session, EPIGNOSIS, a national level online radiology quiz hosted by the White Army. Firstly, I'd like to welcome our quiz master and mentor, Dr. Prajwith Rai, a brilliant consultant radiologist. Welcome to you, sir.
Thank you.
I'd also like to introduce all of our finalists. Dr. Kaustubh K, a post-intern from PIMSR, Karthikeyan, a third-year medical student from MMC, Vicky Datta, a fourth-year medical student from Guwahati Medical College, and Bhumika Hegde, an intern from Coim's Madikeri. Now, with the permission of our mentor, can you please start the quiz?
We can start the quiz now. Okay. Rachana and Thanusha, over to you.
Yes, sir. Thank you. So me and Rachana will be the quiz masters for today. And I want to introduce the quiz. Like, there are 5 rounds in this quiz. First is the basics. Second is connect the dots. Third, identify. Fourth is systemic radiology. And fifth is the rapid fire round. So we'll start off with basics. And the participant order will be, first will be Kaustubh, second Karthikeyan, third Vicky, and fourth Bhumika. Is it fine with all of you? Okay. So, okay, Kaustubh, can you unmute yourself?
Yes.
Okay. So in round 1, the rules include each question carries 5 marks. There is no negative marking in this round, and time given to answer the question is 5 seconds. And the timer starts once I finish reading the question. Okay?
Okay.
So we'll start with Kaustubh. Question 1. Select correct answer, correct option among the following statements. A. X-rays are intranuclear in origin. B. Gamma rays are extranuclear in origin. Time starts now. Select the correct option.
Option B.
Okay. Next question. Name 4 ionizing radiation. Thanks, Rachana.
X-rays, gamma rays, alpha rays, and beta rays.
So the first question answer was both the statements were false. And the second, yeah, you answered 4 ionizing radiation. So you will be receiving +5 for this round.
Okay.
Next is Karthikeyan. Karthikeyan?
Yeah.
Okay. Your question, how frequently are TLD badges checked? Once in how many months or years? Your time starts now, 5 seconds. Stop.
No idea.
Okay, second question. Interaction between low to intermediate energy X-ray beam and inner shell of electrons is known as? Start.
Higgs jumping hypothesis.
No, it's an effect. Time's up. Okay, your time's up. The first question answer was it's checked every 3 months. TLD stands for thermoluminescent dosimeter badges. And the interaction between low to intermediate energy beams with the inner shell is known as photoelectric effect. Okay?
Ma'am, I have texted the answer.
Yeah, 1 second. Yeah, you get +5. I received message only from Vicky. That's right.
Ma'am, it wasn't mentioned if the questions are going to be passed or not in this round.
No, this is for every round, okay?
Okay, fine.
Every round you can answer, you can message to Rachana or Thanusha if you know the answer. And if in case the candidate who is receiving the question doesn't answer it, then you get the point.
Okay. Next is for Vicky. Vicky, unmute.
Yes, ma'am. Yes, ma'am.
Okay. What is the investigation of choice for lactating women with painful breast lump?
Time starts now.
Ma'am, first one is ultrasonography.
Okay. Next one, identify the chamber of the heart in the given image.
Time starts now.
That's left ventricle, ma'am.
Yes. Both your answers were right, Vicky. So you
Thanks,
get
ma'am.
plus 10 for this round, and you had got plus 5. So total score is plus 15. Okay. Next, Bhumika.
Yeah.
Okay. These are your questions. Name the condition seen in the image right next to the question, and what is the X marked in the image? Your time starts now.
Time's up.
I'll read the second question.
Focused assessed sonography in trauma.
Yeah, and what about E?
Emergency.
So any other person can send from the WhatsApp.
Right now.
Even if the candidate answers or not, you send your answer. So if the candidate doesn't answer, it will be taken into consideration. We can go to the answer now.
Okay. The answer is scoliosis, and you can see the corpse angle in this image. It a line drawn from the uppermost vertebra of the tilt and from the lowermost, and then a perpendicular line is drawn. So this X is corpse angle, and if it's more than 10 degrees, then it's diagnostic of scoliosis.
Ma'am, can you check the WhatsApp?
Yeah, I'm going through.
So we are seeing it.
Okay, Vicky answered. Kaustubh 2 has got both the answers right. Second one was extended focus assessment with sonography in trauma. And Karthikeyan has got one answer right. Okay, so the total scores.
And you will not get extra time, okay? You have to answer.
Ma'am,
You have to answer.
check my answer.
Yeah, I checked yours. You got plus 10 for this round. Vicky, am I audible?
Yes, ma'am.
Okay, so the total scores is at the end of round 1, Dr. Kaustubh plus 5, 15. Karthikeyan is at 5. Vicky has scored 25. And Bhumika is at 0. This is at the end of round 1. Now we will be starting with the second round. Okay, in this round, you will get to see 3 images. And if you identify one image, you get plus 2. And you have to connect the 3 images and come to a final diagnosis. And for the final diagnosis, it's plus 4. So if you get the entire connect plus diagnosis right, you get total score of plus 10. There's no negative marking in this round, and you get 20 seconds to answer. After 20 seconds, answers are not considered. And the remaining participants can direct message me your answers. Okay? I'll start with Bhumika this time.
Okay.
Okay, this is your question. And your time starts now.
So other participants can send by the meantime.
There are 3 signs in this images.
So time's up.
Okay.
Okay, 1 second. Vicky has answered. Karthikeyan 2 has answered. And Okay, Kaustav 2 has answered. In the final diagnosis is pulmonary embolism. In the first image, you can see the Westermarck sign. In the second image, Parler sign is seen. And third is the Hampton's hump. Hampton's hump happens when there's infarction of the lung parenchyma at the periphery. So you can notice it's wedge-shaped or dome-shaped opacity. And here, the second image, which I said was Parler's sign, here the right descending pulmonary artery has been enlarged. The size is increased, so it's very prominent, and it appears like a sausage. And the first sign, which I mentioned, was Westermarck sign. Here, distal to the embolus, there is decreased vascular marking. And for this question, Kaustav, Karthikeyan, and Vicky, all of you get +10. And the second question is to Vicky. Vicky?
Yes, ma'am.
Okay. Wait. Your time starts now.
Can I answer?
Yes,
Yeah.
yes. The time is there.
First one is enlarged hilar lymph nodes. Second one is galaxy sign. Third one is panda sign seen in sarcoidosis.
Yes.
Face of
And
panda
first,
sign.
name the
First one is
sign.
enlarged
sign?
hilar lymph node. 1, 2, 3 sign or something Garland sign was there.
Yes, you are right. So you'll get +10 for this. The first sign is Garland's or 1, 2, 3 sign. Here, 1 is the enlargement of the right paratracheal lymph node. 2 is the right hilar lymph node. 3 is the left hilar lymph node enlargement. This is galaxy sign, where you can see multiple small granulomas and then an coalesced larger granuloma. It appears like a galaxy. This is HRCT image. And the last one is gallium 67 scan, where there is increased uptake in the lacrimals and the parotid glands. And the nasopharynx shows normal physiological uptake. And these 3 signs are seen in sarcoidosis. Okay. So Vicky, you get total score of +20 till now in this round. Next is Karthikeyan.
Karthikeyan, are you there?
Yes, I'm there.
Okay. So your time starts now. 1 second. Yeah.
You can see the slide, no?
Yeah, I can see the slide. Yeah, so this is pneumoperitoneum.
Okay. What do you see in the?
Yeah, there is air under the diaphragm in the first one, and in the second one there is that inverted V sign, and there is like through the diaphragm. In the third image, through the diaphragm, the colon is coming up.
Participants, you're sending, right?
Yes, ma'am.
There are 3 signs in this image. You just have to name the 3 signs.
So your final connect is Karthikeyan?
Pneumoperitoneum.
Okay.
Like the first one is air under the diaphragm. Then there is that inverted V sign. I don't know the third one.
Okay, okay, fine.
Okay, third one, you can look at the bubble. That's a clue there. Okay.
Can you check the WhatsApp?
You can. Okay. Yeah, Vicky, checking 1 minute.
How many points for this?
It's +2 for each image, and final diagnosis +4. So total +10.
Do I get any point for this question?
Yeah, your first one was right. Second one, yeah, you answered it right. But this arrow mark pointing on top, was it visible to you here? But we're giving points for inverted V sign, okay?
Yeah.
And then the last one, it was regular sign. Here you can notice air on either side of the bowel because of the pneumoperitoneum. And the first one, what you said was right, but the science name is cupola sign. Okay, and your final diagnosis was right. So you get +8.
Yes, thank you.
Ma'am, what about our
His third one was wrong. So you
yeah,
can see
only
can
the
hear
ones who have answered the third one right will get +2.
ma'am? I have answered the third.
Yeah. Okay. So Vicky gets +2. Okay, next question. Final question for this round is for Kaustav. Kaustav,
Yes.
your time starts now.
Okay, my final diagnosis is achondroplasia.
Yes.
The first image is bullet-shaped vertebral bodies.
Yes.
B is the champagne glass or champagne bottle appearance. And third is a trident hand.
Okay. So you get +10 for this one. Okay, we'll be moving on to the next round. But before that, your scores for this round, Kaustav has scored +20. Karthikeyan, it's 18. Vicky +22. And Bhumika is yet to start. So we'll be moving on to the third round.
Ma'am, can you be please little louder?
Okay, we'll be moving on to the third round. Instructions for this round include there are sets. So each set carries 20 marks, and in a set there are 2 questions. Each wrong answer carries -5. So there's negative marking in this round. +10 for a correct answer, -5 for a wrong answer, and there are 2 questions in a set. And the time given to answer the set is 20 seconds. Okay, you have to answer the question that is mentioned. There will be 2 questions.
The marks for not answering.
Not answering, no negative marking. Only for wrong answer, -5.
Okay, ma'am.
And you can message me, direct message the answer when the question is not directed to you. Okay.
What about negative marks for the WhatsApp answer?
No, sir.
Okay.
Okay. Yes, we will keep negative markings for the WhatsApp answer.
So if the WhatsApp answer is wrong, then you'll get -5 for that also.
In this round. And +10 for correct answer. Okay, so we'll be starting with Kaustav. You get 20 seconds to answer the question. First question, identify the investigation and name the science team.
Time has started.
Okay, I'll be reading the second question. Identify the investigation, name the structure marked as A.
The first image is a IVP.
Yeah.
And the sign we can see is a cobra head sign.
Okay. Second.
The second image is a MRCP.
Yeah.
And the image shown is a common bile duct.
Yeah. So we get +20 for this round. So this is the cobra head sign, and this is the common bile duct seen on MRC. Next question is to Karthikeyan. Karthikeyan,
Are you there? Karthikeyan?
Respond. Can you hear us? Thanusha, just call him. No?
Yes.
Okay. Meanwhile, the next question will be directed to Vicky.
Okay, ma'am.
Okay. Wait, Vicky, one second. Karthikeyan has texted. No, we can't hear you, Karthikeyan. Can you unmute and speak again? Is anyone else able to hear him?
Karthik is not in the Zoom meeting.
Chat.
Oh. So let him join again.
Yeah, am I audible now?
Yes, you are audible.
Yeah.
Sorry, sir.
Okay. This question is direct to you. You have 20 seconds to answer the question. There are 2 questions, plus 10 for correct, minus 5 for wrong answer.
So your time starts now.
Identify the investigation and name the sign in image 1. Second question, identify the investigation and name the probable diagnosis.
So the first image is an ultrasound and the second image is a barium swallow. In the second image, the diagnosis is pyloric stenosis. And whereas pyloric stenosis and there's mushroom head sign is there. And in the first one, it looked like the Mickey Mouse sign. First one is ultrasound and Mickey Mouse sign. Second one is barium swallow and pyloric stenosis.
Okay, wait, I'll just go through the other participants' answer once. Bhumika has answered the first answer right. First image. If you get the investigation wrong, we're not considering the sign. The first part has to be right.
Ma'am, can you check once?
Vicky, you've given 2 answers
Ma'am,
for the first question.
first question.
Which is your response, first one or the second one you have sent?
Second one for the USG for Mickey Mouse.
Okay, it is actually a venous Doppler, and you can see the Mickey Mouse sign. Here, the Mickey Mouse is, if you can see my cursor, this is the femoral artery, femoral vein, and great saphenous vein. So the first question was rightly answered by Bhumika. And like I said, if you don't answer the first part of the question, and did you answer? Yeah, you answered. Wrong. Fine. And the second one was barium meal.
Answer?
Who, sir?
Karthikeyan.
Sir, he said USG.
No, we should take that answer. Hello. Ultrasound is the correct answer again. It is,
yes, sir.
and then it is Mickey Mouse sign in ultrasound. That is also correct. Okay.
Yes, sir. So all of you will be getting. Yeah.
I have answered the second also.
He gets the answer.
I have answered.
He gets.
Yeah. Second one is barium meal.
Okay,
so will
question
I get
one
points
only
for
Karthikeyan gets some marks. Okay.
Sir?
Okay.
First question, only Karthikeyan gets a mark because he has got it right.
Yes, sir.
And the second question, just
barium meal
Okay.
hypensel.
Yeah.
So only Vicky has answered as barium meal. No?
Yeah.
Other as barium swallow.
Even Kaustav, you answered barium meal, right?
Yeah.
So Kaustav 2 gets plus 10.
Ma'am, barium swallow was answered.
By whom?
You can check, rewind the video and check.
No, Kaustav is another participant. Question is directed at Karthikeyan.
Okay. I thought.
Okay. And sir, -5 for wrong answers, no, sir?
yes.
No.
Yes.
So next question I'll be continuing. The question is to Vicky. Vicky, are you there?
Okay. Yes.
Yeah. Next question to you. So, yeah, this is the question. The first question, time starts now. Identify the investigation and name the sign.
First investigation is barium swallow and its corkscrew or rosary bead sign seen in diffuse esophageal spasm. Second one is the Christmas tree sign, and the investigation is cystography or IVU, and it's seen in neurogenic bladder.
What is the appearance? Name the sign.
Christmas tree.
Yes, absolutely correct.
Yeah.
So you get all the points in this round. Yeah, as he said, this is a diffuse esophageal spasm showing the corkscrew appearance. And this is the pine tree appearance or Christmas tree appearance of neurogenic bladder. So next question to Bhumika. Are you there?
Yeah.
Okay. So your question is here. Time starts now. First one, identify the investigation. Name the sign shown. So your second question, identify this investigation and name the sign.
The second one is barium enema.
Okay.
Mm,
So time is up. You want to tell the final answer?
no, it's okay. Only one.
Okay. So we are checking the other participants' answers. So Vicky has answered the first one right. This is a, so as you can see in this, it is an intravenous urogram showing the fish hook or the reverse J deformity, where you can see that ureter is going behind the IVC. So it's seen in retrocaval ureter. So Karthikeyan has also answered it right. Second question, it is a barium enema showing a sawtooth appearance of colonic diverticulosis. You can see the multiple outpouchings. So one of you have sent thumbprint sign that is seen in ischemic colitis. So it is a confusing point between the sawtooth and the thumbprint sign. So you can see this is the appearance which I have shown.
Thumbprint will be more uniform defect which we see in the column because it's a ischemia, it happens diffusely.
Okay.
So the final
Points.
Yeah, points will.
Yeah. Okay. So in this round, the score, Dr. Kaustav is at plus 30, Karthikeyan plus 15. I'm telling only this round, not up to this round. Vicky plus 25 and Bhumika -5. And the total score is Dr. Kaustav at plus 65, Karthikeyan at plus 28, Vicky at 72, plus 72, and Bhumika at -4.
Ma'am,
At the end of 3 rounds.
Yes.
I have answered that barium meal, the last one, idiopathic hypertrophic pyloric stenosis. So will I get points for that? I have answered completely.
So you, who is this?
Yeah, you were given marks for that.
And
You
the
have
second
given-
now,
you have given a
the
mark
fish
for
hook
this.
and IVP.
Yeah, only IVP you got.
The first one in this part you have got this particular answer. The second one you
Yeah.
have answered it wrong. Right?
Ma'am, I have comb here.
Which
So
one? Which
total,
one?
okay, for this question, I will get +5 or +10.
+5.
+5 you are getting because this is wrong, right?
Okay.
Second.
Oh, okay.
Ma'am, how many did I score? Like, I'm Karthikeyan. How much mark did I score?
In this round, +15. Till now, +28.
Okay.
You guys still have time to come back and change your positions.
Yes, we have a clinical scenario coming up next. So this is the systemic radiology. So each set will have 4 questions. So each question will be from different topics. It's from CNS, CVS, RS, and GIT. So you carry like each question will carry the 5 marks. Okay. If you give the wrong answer, it will be -2. So time given to answer each question of the set will be 10 seconds. So I'll be reading the question first, the clinical question. So the 10 seconds will be given to each question. So let's begin with the.
Ma'am, your audio is not clear, ma'am.
So we'll begin with Bhumika. Bhumika, are you ready?
Yeah, I'm ready.
Can you hear now?
Yeah, I'm able to hear.
Vicky now.
Okay, can you hear me now? Bhumika, can you hear me?
Yeah, I'm able to hear.
Okay. So I'll go to the first question. So this is for Bhumika. First question. We'll start after I read the question. Okay. Diarrhea, seizures, and vomiting. On examination, there are signs of meningeal irritation. MRI is given below. What is the most likely diagnosis? So your time will start now. 10 seconds.
Meningioma.
So you have
Meningioma.
your time is up. So next question. Neonate of diabetic. Only Bhumika. Neonate of diabetic mother on day 3 of
not able to hear the audio properly.
Repeat it.
presents with progressive deepening cyanosis since birth. X-ray of the neonate is given below. What is this diagnosis and interpret the sign on the X-ray? Your time will start. Yes? Bhumika?
No,
Sir, can
I'm
you
not
hear me now?
attempting this.
Yes. Diabetic
Okay.
mother, day 3, cyanosis, X-ray of the neonate is given.
Given below. What is the diagnosis? Interpret the sign. Your time will start now.
I'm not attempting this.
Okay, next question to you. 65-year-old male patient who is a known case of COPD now presents with sudden onset chest pain, shortness of breath, and on auscultation, breath sounds are absent on the left side. What is the likely diagnosis? And what is the best phase of respiration taken during the chest X-ray of this particular patient? So your time starts now.
The first answer is pneumothorax, and the second answer is expiratory phase.
Yes. Let's go to the next question for you only. Middle-aged women, diabetic with a chronic alcoholism, presented with right-sided upper abdominal pain. The SOFA score is 3, and abdominal CT was done, and as shown in the below. Likely diagnosis is, your time starts now. So time is up.
Yeah.
Okay. So by the end of this sets, you have got 1 right. Let's look at the answer.
Okay.
And
Can
other
do WhatsApp.
participants, I am checking.
Should we send the answers for all the 4 questions, or can we send it separately?
So you have sent no for all. Well, actually, I've given 10 seconds for every question. So you must have sent by the time, right?
Okay, I thought after the end of all 4 questions we should send. Can I send my answers now?
Okay.
See, you are supposed to send at the time that is given to the other candidate. You won't get any extra time for that.
Previously, we were doing the same thing, right? It will be like that only for this round. So we're checking the answers. So let's come to the answers. The first one is Japanese encephalitis. You can see here, the MRI is showing the bilateral hyperintensity on thalamus and basal ganglia. So that's why and also the clinical scenario is matching for Japanese encephalitis. So next question, you can see this is a classical appearance of egg on string appearance, where it will be globular shape of the heart and the string will be the vascular pedicle. So this is the characteristic picture of TJ, the transposition of great arteries. And also this question is saying it is a neonate of diabetic mother, which is a more specific congenital heart disease associated with that.
Ma'am, your
Rachana,
voice is
it's not
breaking in
audible.
between.
Our third question, Bhumika has answered it right. So it is a pneumothorax, and best phase of respiration will be during expiration. So usually we take during inspiration, the film, but for this pneumothorax, we will take during expiratory phase. And lastly, okay, so can you hear me now?
Yeah.
Is it audible?
Now it is better.
Now?
Now it is better. Yes, it is better.
Okay. I'll continue the next one. So the answer for this will be emphysematous cholecystitis. So the reason is you can see the gas filled in the gallbladder lumen, and also it is a characteristic feature of seen with the clinical scenario here with diabetic and the chronic alcoholic. So answer would be emphysematous cholecystitis. So in this round, third question we were not giving because already Bhumika has answered. So other question, Vicky have given 3 correct answers. Kaustubh have given 1 correct and 2 wrong answers. And Karthikeyan have not attempted. Yes.
Marks for each
from
question.
next onwards, so this will be carrying +5. Okay, if you are doing a wrong answer, it becomes -2.
Okay, ma'am.
So you got +15.
So +15 for Vicky. So set 2 questions for the next participant. Vicky, are you there?
Yes, ma'am.
So we'll start with you. So this is your question. A 3-month-old infant was brought by mother due to irritability and seizures. On examination, there was a bulging fontanelle and macrocephaly was noted. CT is shown below. What is the likely diagnosis? Your time starts now.
Then the worker malformation, posterior fossa cyst.
Yes. So let's go to the next question. Patient was brought with the complaints of progressive chest pain since 1 week and a low-grade fever. So chest X-ray shows the following finding. What is the likely diagnosis?
Pericardial effusion, water in bag signs, bottle sign.
Okay.
Can you repeat
Next
the
question.
sign?
55-year-old male patient presented with non-productive cough and fever. Sign.
Or sign, money bag, water bottle signs.
Yes.
Okay.
So next question. 55-year-old male patient presented with non-productive cough and fever since 1 month. Chest X-ray is normal. HRCT is given below. What is the likely diagnosis? Your time starts now.
Fungal ball or aspergilloma, the air crescent of the monod sign.
Read the history.
No.
History clearly.
Lung abscess. Fever.
No, your time's up. Let's go
Okay,
to the
okay,
next question.
Okay.
So 85-year-old woman presented with a history of 48 hours of generalized abdominal pain and vomiting. On examination, she's dehydrated. Plain X-ray shows linear gas-filled structure presented in the right upper quadrant with short branches extending into the dilated small bowel loop. What is the likely diagnosis? And your time starts now.
Rest of the findings are in the image.
Okay, I won't answer this one.
Okay, so your time's up. Let's see the other answers. So no one have.
Vicky, for this round, this set, you've answered 2 right and 1 wrong. Okay, so total score is +8. And Bhumika tried, but both her answers were wrong, so you get -4.
Anyone can try this answer. Try to answer this.
So anyone else can answer this? Can unmute and answer?
Pneumobilia, gallstone ileus, like
Yes,
regular
yes.
stride, regular sign, regular sign.
Regular triad. Yes. So let's.
Karthikeyan, you didn't
Type no. What's up?
I already typed it. Didn't you receive the answer?
No, not yet. Didn't receive till now.
Okay. There was a small net connection issue. It isn't sent yet.
Sir, Prajwith sir, what to do for this?
No, we'll take the answer because he gave the answer, no? He knew the answer, so we'll take it. We'll consider it.
Yes.
So,
Sorry, I didn't know the connection was gone. Sorry.
We'll not give marks next time, Karthikeyan.
Sorry, sir. Sorry. I didn't notice it.
Okay, so let's go through the answers. The first one is, as you said, right, it's a Dandy Walker malformation. So you can see that there is a posterior fossa, ballooning of fourth ventricle, and failure of opening of foramen magnum. Next question, it is pericardial effusion. As you rightly said, it is a money bag sign. Okay. So this question, it is a pulmonary tuberculosis. You can see the history with a non-productive cough and fever since 1 month. Chest X-ray is normal. So you can see a thick wall cyst here in the left side. Lastly, it is a gallstone ileus. So it is a regular triad. So components. Anyone can tell the component of regular triad?
Pneumobilia, small bowel obstruction, and gallstone obstruction. And
Gallstone?
Pneumobilia, then small bowel obstruction, and the radiopaque gallstone.
Okay. So let's go
Where
to
it
the.
will be? Where will be?
And this ileum.
Yeah, correct.
Correct.
It will be there. Yeah.
So we'll go to the next one. Next set. Next set is to Karthikeyan. Karthikeyan, can you unmute yourself?
Yeah, I'm there.
Okay. So this is your question. The first question for you. 40-year-old with the history of recurrent attacks of tingling sensation in spine and limbs.
This is multiple sclerosis. Would have sign Darwin fingers sign.
Okay. So what is the sign?
This is Darwin fingers are seen, and this is would have sign, Lermit sign on flexion, and would have sign is that on hot water there will be exacerbation. This is Lermit sign, neck flexion, barber chart.
Darwin sign you're telling?
No. This is Dawson's fingers in multiple sclerosis.
Yes. Next question. 50-year-old male patient presented with acute onset of chest pain. Further, CT scan was done and showed the following image. What is the likely diagnosis?
Dissection. Aortic dissection.
Yes, exactly. Next, a 3-year-old presented with fever, drooling of saliva, muffled voice.
This is thumb sign, the epiglottitis.
Correct, absolutely correct. So next question, 48 hours old baby born at 36 weeks of gestation regurgitates when feeds are given. Abdominal examination reveals airless scaphoid abdomen and contrast study is given below. So what is the likely diagnosis?
Is this a case of esophageal atresia associated tracheoesophageal fistula?
It's absolutely correct. So he gets all the points. So it will be plus 20. So as he said rightly, it is a multiple sclerosis with Dawson's finger. So you can see second question is aortic dissection forming a lumen, false and true lumen. Then third question is characteristic thumb sign. You can see here thumb sign, characteristic thumb sign seen on lateral X-ray of the neck. And lastly, it is a esophageal atresia associated with TEF. So this is a very important question. The association of tracheoesophageal fistula, classical 5 types. So type A will be having a proximal atresia. Both atresia will be there. So type B will have fistula in the proximal end and distal will be atresia. Type C will be proximal atresia and distal fistula. And type D will be the fistula on both the sides. And type E will be isolated stenosis. So type C out of this is the most common. So this is one more image for the same. So next question to Kaustubh. Kaustubh, are you there?
Kaustubh, please respond.
Yes, sir. Am I audible?
Yes. Now you are audible.
Yeah.
Your question set will start now.
Okay.
This is the first question. 20-year-old male presented with seizures. On examination, there was hypopigmented macules and facial angiofibromas present. CT was done and shown below. What is the likely diagnosis and what is the CT finding? Your time
This is
starts
tuberous sclerosis or bone village disease.
now. Yes.
And CT finding are subcortical tubers.
Subcortical tubers. You want to try again? Your time's up. We'll go to the next question. 30-year-old women presented with hypertension, chest pain, cramping of legs. Chest radiograph is given and revealed the following condition. Now, what is the cause underlying this presentation? So, what is this chest X-ray showing?
This is
Your time starts
coaptation
now.
of aorta.
Absolutely. The next question. Term neonate was born by vacuum-assisted delivery, develops mild respiratory distress 1 hour after birth. Arterial oxygen saturation is more than 95% even without supplemental oxygen. 5 hours later, chest X-ray was performed and it is as shown. What is the likely diagnosis?
This is tachypnea of newborn.
No, name the sign as well. You can see one sign characteristically.
This is Batwing sign of pulmonary edema.
No.
The neonate.
Other participants are sending, I guess. Time is up. Let's go to the next question. A man presented with fever and multiple episodes of diarrhea. He was reluctantly treated with antibiotics for pneumonia. His laboratory investigation showed increase in WBC counts. Sigmoid and his CCT appears as below. So what is the likely diagnosis and what is the sign seen on CC? So this is the image and here is one more image. Your time starts now. Your time's up.
The slide is not visible to me.
Is it not visible?
No. One sec, let me
Sir, is it
refresh.
visible?
Visible for us.
Visible.
One sec. Yeah, I can see it now. This is pseudomembranous colitis.
Okay, sign. No, time's up. Okay. So Let's see whoever answered. Yes.
Okay, Karthikeyan, you answered 2 right, and Vicky has answered 2 right.
Okay. Let's come to the answers. The first one, as I said, it is tuberous sclerosis, and CT is showing subepidermal hematomatous nodules. You can see in this. These are the hematomatous nodules which can be seen in the tuberous sclerosis. And can you name what is this hypopigmented macules? Anyone?
Coffee alloys.
Ash leaf macules.
Yes, exactly. What is facial angiofibromas?
Nevus phlegma.
Any other names you know of tuberous sclerosis?
Bonville Pringle.
Bonville disease.
No, any findings of tuberous sclerosis?
Shagreen patches.
Yes, yes. And this
Kuhn's
adenomatosis.
tumors in the nails.
Okay, so let's see the second one. So this is, as I said, it is a coaptation aorta, which is showing characteristic 3 sign, right? So this is the image. You can see the characteristic 3 sign. And this one is pneumomediastinum, showing a spinnacle sign. Okay, this is a spinnacle sign, or it's also called angel wing sign. So he got it wrong. But Vicky has answered it right. So only Vicky answered this as pneumomediastinum, correct? Okay, so let's go to the next. So this is pseudomembranous colitis. The clinical scenario is the antibiotics. Okay? So, and also the ECT is showing what is called as similar to this. Okay, this is the accordion sign. And this is what I told as spinnacle sign.
And the last question, Karthikeyan and Vicky has answered. And even Bhumika has answered.
Okay, so we have come to the end of this round of systemic radiology. So suppose,
Okay. Kaustubh is at 72. Karthikeyan has scored 58. Vicky is at 90. And Bhumika is at -4.
But
Vicky is leading
marks.
Yeah,
My marks for total
90.
90.
Yeah, 90 till now.
Ma'am, can you check once, because I have got 1 plus 15 plus 8 and plus 10 in this round.
Okay, we'll start with the next round and I'll cross check and
so by the time she checks the marks, we'll go with the next round. So this is a rapid fire round, final round of this quiz. So here each question will carry 10 marks. So it is a game changer. So 5 marks will be for the negative or wrong answer. Even no answer will carry -5. Even if you don't tell the answer, it will be -5. So time given to the answer, this set of 10 questions will be 60 seconds. In 1 minute, you are going to tell the answers. So let's start with the Kaustubh. Kaustubh, are you there?
Yeah.
Okay. So let's start with you. I'll be reading the questions. Okay, so I'll be reading it fast. So you need to tell at that moment only. So for each question, you need to tell the answer. If you don't know the answer, tell pass. So let us review in the end of. If the time is remaining, then we'll review in the end. If you tell the answer, then you cannot change the answer. Is it clear?
Okay.
Okay.
Can I answer immediately if I know it, or I have to wait till the question is completed?
No. If you know the answer, if you can just cut me short. So I won't be continuing the whole question, so that you get more time for the review.
Okay, great. Fine.
Oh, okay. So let's begin with this round. Okay, so it will be 60 seconds, okay?
Ma'am, no pass, no, for this round. Sorry,
pass,
no
no
what?
pass.
No,
No
WhatsApp. We
WhatsApp.
cannot mention. Okay.
No. It's only for the that question to that particular person. Okay, let's start.
Yes.
Sounds good?
Yeah.
Okay. So this is the first set. Yes. Your time starts now. Probable radiological appearance is seen in
Osteoclastoma.
SI unit of radioactivity is
Pass.
investigation choice for bronchiectasis is
HRCT.
puff of smoke appearance on cerebral angiography seen in
Moya disease.
dog's ear appearance of bladder is seen in
Pass.
scimitar sign is seen in
Pass.
most commonly used target filter combination in mammography is
Pass.
comet tail sign on CT chest is seen in thorax.
Pass.
Best view to visualize middle lobe pathology of the lung is
Best view of X-ray.
yes.
PA view.
Which view or position you can tell me.
PA view.
Okay, next question.
Name the highly radiosensitive tumor. So you have your time is up. So you don't have the review time now. So your answers are 3 correct. Okay. So bubble radiological appearance is seen in osteoclastoma. You said that's correct. SI unit of radioactivity will be becquerel. Bronchiectasis investigation choice will be HRCT. That's correct. Puff of smoke appearance is Moya disease. That's correct. Dog's ear appearance of bladder is ascites. That is correct. That is wrong. That is the answer. Scimitar sign is partial anomalous venous written. Then target filter combination in mammography will be molybdenum. Comet tail CT will be round at lactasis. Middle lobe pathology best view will be lordotic view. And highly radiosensitive tumor will be remembered as a mnemonic called Wilms. Okay, so there will be Wilms, limb sarcoma, lymphoma, multiple myeloma, and seminoma. So this was your first set. You are done with the rapid fire round. So by the end you get so -5 will be there for your each wrong answer and your no answers. Plus 10 for the right answer. So it will be plus 30, minus 35. So your final will be -5. Okay. So next participant will be Karthikeyan. Are you there?
Yes, I am there.
Okay. So your set will begin now. So this was the answer. Okay. Next, your time starts now. Fallen fragment sign on X-ray seen in
Pass.
SI unit of radiation exposure is
SMVs.
sorry.
SMV. Okay, next one.
Initial choice for renal stone is
IVP in IV biology. Ice cream cone appearance is acoustic neuroma.
windsock appearance on barium is seen in
Pass.
Oreo cookie sign on
Cookie sign is seen in effusion, like between 2 layers. It is a pleural effusion.
Okay. Investigation choice to diagnose
Diagnose
dislocation of hip in neonates is
MRA. CT.
next
Highly
question.
radio-resistant tumor is RCC. Which structure does not form a
Hylar
RCC? HCC is Hylar shadow and X-ray. Pass. Fallen fragment sign is unicameral bone cyst.
Correct.
Windsock appearance on barium is I'll go some nutcracker esophagus.
Your time's up.
Monod sign.
Okay. Your time is up. So you have got 3 right. So fallen fragment sign is hello. What happened?
Which 3, right?
Yes, sir. 3 fallen fragment sign is correct. Ice cream cone is correct. Radio resistant tumor is correct.
Okay.
So fallen fragment sign is simple bone cyst. Radiation exposure SI unit is coulombs per kg. I didn't hear your answer actually. Your renal stone investigation choice is NCCT. Then ice cream cone, as I said, it is acoustic neuroma. Windsock on barium is seen in internal duodenal diverticulum. Oreo cookie sign, as I said, it is pericardial effusion. Then investigation choice for congenital dislocation of hip in the neonate will be ultrasonography. Monod sign on CT chest is in aspergilloma. One which doesn't form the hilar shadow will be lower lobe pulmonary veins. Okay. Then radio-resistant tumor will be hepatic carcinoma, or osteosarcoma, melanoma, or pancreatic carcinoma.
Yeah, what and all did I answer right? 1, 4. 1, 4, 6, and 10, right? 4, right?
Yeah, Oreo cookie you told. Exactly. Local effusion or pericardial effusion?
What did I say?
You said pleural effusion. It was pericardial effusion.
Okay, fine. Okay.
So your score, you've answered 3 right, so you get plus 30 because there's negative marking for no or wrong answer. It's minus 35, and total score is minus 5 for this round.
Okay. So next to Vicky.
Yes, ma'am.
Are you there?
Yes, ma'am.
Okay. So let's start with your set. So your question starts now. Winking owl sign on X-ray is seen in
Skeletal, spinal, skeletal vertebral metastasis. SI unit of
absorpdosis.
Gray. IUC for Penco's tumor is MRI. And mother-in-law sign is in meningioma. And imaging modality of choice for pancreatic divisum is ultrasonography. Antral or Holman-Miller is angiofibroma. Penumbra on MRI is seen on ischemic stroke. Then best investigation pathway localization system may be scan. Radio-resistant sensitive organ in human is the gonads. Sorry, not gonads. Gonads are blood cells, bone marrow cells. The best radio view to visualize right lung is right lateral oblique view.
No. Okay. So you can review. Your time is there.
Okay. The best radiosensitive organ is the blood cells, leukemia, blood cells, radiosensitive organ. Organ is testis. Okay. Organ is testis. Testis or gonads.
Antral sign, what did you tell?
Angiofibroma. Juvenile nasal angiofibroma.
Okay. Your time is up.
Okay.
So to see the answers, the winking owl sign on X-ray is seen in vertebral metastasis, correct? Then absorbed dose SI unit is gray. Investigation choice in Panco's tumor is MRI. Mother-in-law sign is correct, that is meningioma. Modality of choice for pancreatic divisum is MRCP. And antral or Holman-Miller sign is seen in juvenile angiofibroma, it's correct. Penumbra sign is seen in subacute osteomyelitis, okay. PTH localization is systemic scan. Then radiosensitive organ is gonads. You have changed the answer.
Gonads only I have told. Gonads first I got gonads only I have told.
Okay. So view for the right lung visualization will be left anterior oblique. It's not right oblique. Okay.
Ma'am, SI unit I get correct. No, I get gray. I told.
Sir, did you hear him saying gray, sir?
Yes, I told gray.
SI unit I don't remember. We'll review it like after we have the recording. So that one question, even I'm not.
I told gray.
Did any other participants answer? What did he answer? If they tell, then we can take. Anyone? Did you hear what he told for SI unit for? Okay, we'll review it then. No problem.
Okay, we'll see, sir. So next participant will be Bhumika.
How many I get correct for this?
For this, you get 6.
With SI unit or without?
With SI unit.
Okay.
So let's see that. Let's see that in the end. Okay. Then Bhumika, are you there?
Yeah, I'm there.
Okay, let's begin with your set. So your set is here, and your time starts now. Sunray appearance on X-ray seen in
osteosarcoma.
SI unit of absorbed dose equivalent is.
Next.
Investigation choice for aortic aneurysm is.
Angiography.
A dot in a hole sign on CT is seen in.
Next one.
Triangular cord sign in the neonate is seen in.
Next one.
Head-shaped vertebra is typically seen in. Investigation
one.
choice for placenta accreta is.
MRI.
Okay. Best view in X-ray to identify pleural effusion is.
Right lateral oblique view.
No. A most common radiation-induced cancer is.
Next one.
Half-life of technetium-99. So your time's up. Okay, so you've got 3 right. Sun ray appearance on X-ray is osteosarcoma, correct? Absorbed dose equivalent SI unit is Sievert. Then aortic aneurysm, CT angiography. So dot in hole sign is neurocysticercosis. Triangular cord sign is biliary atresia. Head-shaped vertebra is seen in sickle cell disease. Placenta accreta, investigation choices MRA, that's correct. X-ray view, the best view for pleural effusion is lateral decubitus view. Minimal fluid effusion, fluid was also seen in this. Radiation-induced cancer is most common is leukemia. Then half-life of technetium-99 is 6 hours. So you get 3 correct. No. So we have come to the end of this quiz.
And I'll be announcing the top 3. At third is Karthikeyan. He has scored 48. Then second place is Kaustubh. His score is plus 61. And at first place we have Vicky. Vicky, can you guess your score?
125 plus, I don't know. I'm not calculating now.
You're cross-checking now. It is plus 145.
Okay.
Considering whatever doubts you
We
have.
will give you that answer that you
No problem, sir. Not
controversial
needed.
answer, we'll give it to you.
Okay, so we have 2 bonus questions are like we have kept for tiebreaker. Let's see, anyone can unmute and answer this. Okay, can you interpret chest X-ray? Anybody can unmute and answer.
Mitral stenosis.
Chilitis syndrome.
Yes. Chilaidity. It's the pseudo pneumoperitoneum. You can see bowel here, right? Under the diaphragm. Okay, so this one, can you identify the vessel mark?
ACA. Anterocerebral artery.
Yes. Correct. So yeah, we have come to the end of the quiz. So the final score will be Vicky with 145 and Kaustubh is 61.
Okay, and it was a great performance by all the 4 participants, and you have performed really well even in the prelims. It's good that you are preparing so well at this stage. And also, I want now to thank special thanks to Rachana and Thanusha both. They have worked a lot and prepared this quiz, and it's a great deal of hard work that they have put. And I would like everyone to unmute yourself and please Zoom Rachana, Maya and Thanusha, and please give them a big round of applause by unmuting yourself. So it's a request to everyone. So keep doing it. And you also keep participating in all the quizzes that these people are going to conduct in future. Good work, Rachana. Good work, Thanusha.
Thank you so much, sir. It is because of your help, sir,
Okay,
we could do this quiz.
Over to the. Okay, thank you from my side too.
And the winners of this quiz, that is Vicky and Kaustubh, will be receiving books and eCertificates. And yeah, so congratulations to all top 4 finalists. It was nice hosting you guys.
So congrats for the top 10 people also. They have done really well. So especially Zoya and Tanit, who has been our 5th and 6th participant.
Thank you, ma'am.
Any feedbacks you guys want to give so that our quiz masters can do it better next time?
Yes, sir. First of all, it was a great experience participating in this quiz because I have been following the White Army since the lockdown period. They are doing amazingly well with the case presentations and the different case discussions and the quizzes. This helps in motivating all the students who are not that really exposed to the clinical cases in the hospital during the lockdown period. So I have learned many things from this White Army platform, and also the quizzes are amazing. The standard of the quizzes are like the entrance exams only. It is close to the NEET PG and the INS exams. So it's very great. Thanks, thanks everyone.
CSM you won pediatrics, now back-to-back 3 quizzes.
Yes, ma'am. Yes, ma'am.
How many quizzes have you won, Epignosis?
3 till now. I have attended 3 only till now.
Wow.
So
actually, we were happy to see you
after quiz competitions.
Yes, sir.
Well, I mean, there are a lot of fan following now to you after all the quiz competitions.
Yeah.
Okay, anyone else? Anyone want to speak anything? Then we can wind up the session.
Nandini, over to you.
Yes, ma'am. Do I end the session?
Yeah.